Senator Mazie Hirono is pushing hard to restore Medicaid eligibility to migrants from key areas in the Pacific. Today, Hirono was in Hawaii to meet with healthcare providers. Hirono calls the plan a win-win. Migrants would get their benefits, and Hawaii can stop footing most of the bills.
The issue started with this: U.S. nuclear tests in the 40s and 50s like this one at Bikini Atoll. The residents of those areas, Micronesia, Marshall Islands and Palau, are protected by Compacts of Free Association, or COFA, treaties that allow them to enter freely into any of the United States with all the benefits of U.S. citizens.
And the health care is a vital part of that, because there's certain health situations back home that that the infrastructure is not there yet for it. So therefore, I think we feel that there is a vital need for this.
These COFA migrants used to be covered by Medicaid, but that eligibility was lost inadvertently several years ago. And since then, the states have borne the burden of that health care, Hawaii to the tune of nearly $43 million a year. Senator Mazie Hirono met with COFA advocates today at the Kokua-Kalihi Valley Comprehensive Health Center, which has seen its share of COFA patients. The senator pushed for a provision in the current immigration bill that would restore Medicaid eligibility. If passed, the state of Hawaii would be reimbursed for roughly $20 million a year.
We have these agreements with our compact migrant states because of our national security needs. So our country has a responsibility to provide appropriate levels of support for the compact migrants, who, by the way, are not immigrants.
Providers like Kokua-Kalihi Valley Comprehensive Health Center say that provision is essential for the big picture.
It's mission critical. There's no more important issue facing us right now. About somewhere between 25% and 30% of our patients are coming from those nations. If we are unable to provide them decent medical care, and we're the provider of last resort, where are they going to go?
Now, the Healthcare Association of Hawaii released this statement late this afternoon saying Hawaii invests an estimated $40 million for their care annually, but recoups only about a quarter of that in federal funds. This legislation would reduce those shortfalls and help Hawaii's health providers to continue delivering quality care to this diverse group of patients.